My name is Natalie Arrow and I am the manager and the head vet at the BDMLR Cornwall Seal Hospital. We are essentially the ICU of the seal world, so we are providing that really intensive care that seals need initially just after they're rescued for those first few days, first couple of weeks, when the seals are really at their worst and they need that very, very high level of detailed veterinary care. So we have something called a haematology machine, and that will basically take the blood and look to see what sort of cells there are in the blood and how many there are of those. So we all have red blood cells and white blood cells, for example, and it will be able to tell us for that seal how many does it have of each of those and all the various different types, and that helps us to guide our decision making and our treatment process.
To run a blood sample, you just want to make sure that the sample's nicely mixed by inverting it a few times. And then on this machine I would press run, and I have to put in an ID for this patient, press enter, and then I press run again, and it tells you to make sure the sample's well mixed and to take the lid off the sample and pop it in here. And then I press run again. And then the machine will start to do its thing and hopefully give us results in 5 or 10 minutes. And voila. The white blood cells are coming back normal, as are neutrophils and things, but I am suspicious that there is something going on in this pup, so we're going to have to keep a really close eye on it basically.
We're very, very fortunate that we have got these new blood machines to use. It isn't something that you would find really routinely in all sort of wildlife rehabilitation settings. The reason that it's so important for us is because we are dealing with seal pups straight after rescue. Basically, they're in their most need of veterinary assistance. The pup would be rescued, obviously, from whichever location that it's at the time, normally by one of our BDMLR medics. They will go out and do the assessment, and with our head office they will then work to decide if that seal needs to come in and have further care or not. And if it does, and there aren't space at the big local rehabilitation centres, then that's when the pups will come straight into the hospital here. And normally we will have a member of the veterinary team here ready to help admit that pup. So as soon as the pup arrives on site, we'll bring them in and we will get them weighed first and foremost while they're still in their transport crate. And then we'll get them moved into one of our pens here. We'll be able to then let them have a bit of a break and a rest from transport for a moment. And we'll get together the materials that we need to do their assessment. And once they've had a moment to catch their breath, we'll then go in and catch the pup, and then one of the veterinary team will do a full assessment.
You're looking better than last week. You certainly are. Thank you very much.
And again, working from nose to tail, checking the whole of the seal, listening to their heart and lungs, all that sort of good stuff.
Checking over the front flipper, make sure there's no swelling, no wounds, the nail beds aren't traumatised. And then if you run your hand down their palm, you'd hope they make some effort to grip onto you. He sounds nice and clear on his chest, but we all know that can change quickly.
And they'll also take that really important blood sample as well and get that run through the machine.
Just going to grab the wound stuff. See where that wound was. It was, I think, is it this side? Yeah. You got him? It's definitely a significant puncture. The tissue is a bit thickened and swollen around it. Just wondering whether it's let infection in, but then it doesn't feel that swollen here. It feels swollen here.
Then they'll take all that information that they've gathered about the seal, including information that the medic would have given them about the rescue on the beach and what the seal was like on the beach as well. They'll take all that information and use it to create a treatment plan tailored to that pup, as well as a feeding plan as well. And then obviously we'll get going and get them moving in the right direction. Later in the season, we will see pups that have lungworm, which is an infection that literally does what it says on the tin. It is essentially an infection where there are worms living inside the seal's lungs, and unfortunately when they get a significant number of those worms starting to build up, it will cause some really, really serious health problems, as you can imagine, and they have great difficulties with their breathing, and they need very intensive medical management in here. They're certainly some of the most critically ill patients that we treat. So in terms of sort of veterinary care, we're providing kind of a whole range of drugs that we'll give them, you know, either by mouth or by injection each day.
So we'll give this into the muscle layer in seals because they don't have such an easy to inject into subcutaneous space like you would see in a dog or a cat. So we go straight down into the lumbar muscles, and if you inject into the blubber accidentally in seals, the drug won't be absorbed very well because there's not very good blood flow in the blubber, and there's a risk of abscess formation as well, so we'd rather just go deep into the muscle. Something else that we do here, which is something that we've kind of started to develop over the past couple of years, is that we also use steam therapy to aid with the lungworm treatments. And essentially we're using the steam just as many humans would when you have congestion, you have a really blocked up nose. The seals are the same, and they get really, really snotty. And so that steam is aiding to relieve some of that congestion, but at the same time we can also put some of the drugs that we want the seals to have on board inside the nebulizer. So essentially then it's going to come, those drugs will come out in the steam, and the seals are going to be able to breathe them straight into their lungs so that they can take action right where the worms are. The seal barn that we're in here is a really, really fantastic environment for seal pups during those really early stages of rehabilitation. And we have designed everything about this barn to try and suit exactly what the seal pups need. So for example, it's very well ventilated, and that's because of the design of the boarding that we have down each side of the building, which actually has wooden slats at the upper part of the walls, which allows airflow between them. So obviously the seals are down at a lower level in the pens, surrounded by the concrete walls. So they're protected from the wind, from directly getting any sort of drafts on them. You'll also see that it's very light in here, and so we've actually designed the roof so that some of the panels are transparent. So it allows natural light to come in, and then the seals are then experiencing normal daylight hours. In here we also have security cameras which actually cover all of the seals' pens, and this is really good because it means that the veterinary team can actually observe the pups from their homes. So if we have a seal that we're particularly worried about, we can actually sit at home and check on them every now and then, and if we're at all concerned we can pop back in and see how they're doing. We also have pens that are much larger than pens that we've had before, so the seals have got a lot more space, which is fantastic. They all have a nice comfortable rubber mat to lie on, and they also all have an individually controlled heat mat in their pens, which means that if we have very small, very cold pups, we can give them a nice warm heat mat to lie on, which will really, really help their recovery. So we have a whole variety of different types of people that come and help run this facility as volunteers. And we have a number of them who are in fact qualified veterinary surgeons and veterinary nurses who come in and bring all of their skills into the centre. But at the same time we have people from a whole host of backgrounds as well.
Some of those will have backgrounds in animal care and perhaps in wildlife care specifically, which is fantastic. But we also have a whole range of other people from all sorts of backgrounds, not necessarily to do with animals. And the point is that all of those people can come here as trained BDMLR medics and get stuck in and help the seals. And we will provide that training that they need to get comfortable and to get confident.
So he's gripping onto me now.
There we go. Nice.
The volunteers here are the absolute heart and soul of the centre. They are absolutely critical. They are the people coming in every day, in 3 teams. We'll have a morning and a lunchtime and an evening team coming in to do all the checks for the seal pups that are here, all of their feeds, getting them nice and clean, any sort of medical treatment that they need to be given.
Got this huge corneal edema, so there's going to be an ulcer there.
They're doing that round the clock through the winter. So we have a very long, cold, dark winter here in Cornwall. So these are extremely dedicated and enthusiastic people who are coming in those sorts of conditions to look after the patients here. So in the southwest, we do have 2 large rehabilitation centres where seals can be sent to for full rehab. But unfortunately, just because Cornwall is so busy with the number of seal call-outs that we get, even very early in the seal season, those 2 centres will find themselves full and at totally full capacity. They won't be able to take any more seals. So that is where we step in as essentially an overflow facility so that we can make sure that any more pups that come in have definitely got somewhere to go, and we will provide them with that really high level of care that they would get at those other centres as well, until then they do have some space. At which point then we will move the pups over to the facilities that have got space for them, and then they have the ability to get them into their large pools and other such facilities to get them fit and ready to go, hopefully back out into the sea. Typically, seals will be ready for release when they've reached what's deemed to be a healthy weight, which is going to be somewhere around the sort of 30 to 40 kilo mark. And also they'll have a veterinary assessment to make sure that they have a clean bill of health as well. They will have been building up their fitness in the pools over the last few weeks of their rehabilitation to make sure that once they are released, they're ready to go back out and to catch their own fish.